Hi everyone, welcome back. Today we're joined by Liz Hyde, an RN at Intermountain Medical Center who works in the shock trauma intensive care unit here, to talk about her experience in New York. She was part of the 100 caregivers deployed for our Intermountain COVID Response Team that went out to New York to help them in the fight against COVID-19. Liz was stationed at the Southside Hospital in Long Island, New York, and we're going to talk a little bit today about what happened while she was there. Liz, thank you so much for joining us. We really appreciate it.
Yes, I'm happy to be here.
So Liz, before we get into New York, tell us a little bit about what you do at Intermountain Medical Center, how long you've been working for us, and a little bit about your experience overall.
Yeah, so I have actually been a nurse for Intermountain for about 10 years. I started actually down at Dixie, and then I transitioned up here where I have been in the shock trauma intensive care unit for about 7 years. And I work there. We see patients, any kind of trauma that needs to be in the intensive care unit, and it ranges from that to we get liver transplants to pneumonia patients. We're kind of like a catch-all of the hospital. We kind of take whatever is given to us.
So when you first heard about this New York experience, what went through your head? Why did you consider even volunteering? And what were some of those pros and cons you thought about when you heard about the opportunity?
So when I first heard about going to New York, I talked with my husband a lot about what I would see and what would happen, and being away from your family. I have a 4-year-old at home and a husband at home, and to leave them to go to New York for 14 days kind of seemed a little bit overwhelming. But then I stepped back and thought about, I think in our lives we get really caught up in poor pitiful me and my life's so bad and I'm having such a hard time. We're in quarantine and I'm trying to homeschool a 4-year-old, which I never thought would happen in my life. And so I think I just decided to just kind of take a step back and really think about this. I'm in a pandemic, something that's never happened in my lifetime, something that I hope never happens again. And so I considered it more of a once in a lifetime opportunity to have the skill set. Never did I think that my nursing skills and my critical care skills would be needed in this kind of situation. So the opportunity that I had to go out, to use my skills, and to aid in this pandemic is something that I really took as such an amazing opportunity. And to be able to go help the people. And I think you always worry about I'm putting myself in the front line of this sickness and getting sick and bringing it home. But I just had to kind of put my faith over my fear and go out and take this amazing once-in-a-lifetime opportunity to help the people of New York.
How did you, if you had to, explain to your 4-year-old what you were doing and where you were going?
Well, so we used the sickness a lot, so that was our term. I said, I'm going to help people who are really sick with this sickness and to help them, to aid them, and to go do work. So I just said, I'm going to work, which she knows now, and to help the people with this sickness. And actually, when we came back, I was like, do you know what the sickness is? And she was like, yeah, Mom, COVID-19.
Wow. That's very impressive.
So I think that she was able to grasp and catch on to what I was doing, and what even is going on in our communities now.
So after you got to New York, have you been there before, by the way?
I have.
Okay.
I've been to New York a couple times, a handful of times.
I know there's a few people who had not been to New York previously, and this was their first experience there. So for you, you've been to New York before. What were your first thoughts when you got off the plane and experienced this totally different reality than what you were used to?
Even just getting dropped off at Salt Lake International Airport, when I very first got dropped off, I think I was one of 2 cars in the drop-off area. And then this boarding the plane and getting to JFK, where normally it's so much hustle and bustle, so much, business and everyone's there. And it was eerily empty. And just the uncertainty of what we were going into, and kind of the emptiness that we felt there. As we boarded the bus, I just had to kind of pump myself up and be I'm doing this. I came here. Everything's going to be okay. And I'm going to help these people. because the quietness that was in the airport and that was around the city was a little bit unsettling. Like, we actually had the opportunity to go into the city one day, and as we drove down Fifth Avenue, such like a common place, like all the storefronts were cleared out, Times Square was empty, just like such a almost a calm, quiet feeling that like I have never experienced in New York.
Yeah, I used to live there, and I know that walking around Times Square is a very busy place, so
Yeah.
I can't imagine what it feels like to be there when there's such this eerie quietness happening. So what is something that you remember seeing or experiencing in New York that made you say, wow, like this virus is real and it's actually something we should be taking seriously?
So even just going into my first shift into an intensive care unit that wasn't an actual intensive care unit. So what they did was they took other units, like a telemetry unit where not intensive care patients would go, and they opened it up and made it into an ICU. And so walking into there and kind of like trying to like understand the flow of their work and how they were working through this like different unit, and just the severity of the illness in the patients was kind of like made me take a step back, because we had seen COVID in Utah. We've seen it in the ICU, but not on the level that I felt like we saw it in New York. So I just had to like take a step back. I had to like reassure myself, like, you know, pull knowledge and remember things, and just like the level of illness and severity in these people, it was kind of shocking.
You also shared a lot of experiences on our Intermountain blog that we wrote, Intermountain Stands with New York, specifically about compassion during the pandemic. Can you share that story with us now?
Yeah, so my last couple of shifts, I had the opportunity to work with a nurse from Logan Regional Medical Center. His name was Chad Nilsson. And we were actually like paired next to each other. So like my patient assignment was next to his patient assignment. And I had a really busy shift. I had to travel off of the intensive care unit with my patient. We have to go with our patients whenever they travel. And I had a really busy shift, and one of my patients just needed a little bit of extra care and just like having someone next to her that I didn't have the time, because I had 3 patients where in normal ICU, these patients would either be like one nurse to one patient or one nurse to 2 patients, and I had 3 of them. And so I had gotten back from traveling with my patient, and I was walking to get something out of the supply room, and I walked past my patient's bed, and there was Chad sitting next to my anxious patient, trying to calm her down, trying to talk to her. I mean, I can only imagine what it's like to be intubated with a tube in your throat without any family member there. And when I walked back past, he was still sitting there. And I think that one thing that it just made me realize is like, not only are these people sick, not only are they can't have family members because of the level of the pandemic and the severity of the illness and the unknown. So they can't have family members next to them, and it just made like that level of like emotional care. Like, not only am I a nurse taking care of these physical needs, I need to be able to provide the emotional needs for these people, because at the end of the day, they are a human.
I remember reading that story that you shared, and it's really interesting to hear these stories from your guys' perspective and your guys' eyes, because we don't see that here in Utah. We don't get that level. So it's been a really interesting lesson to kind of figure out what's been happening in Utah versus New York. So when you came back to Utah, what were some of those lessons that you thought about from your time in New York, and what did you want to bring back with your team here, with the shock trauma unit? What did you really take back with you from your experience in New York?
One thing that I thought that they did well in New York was just like the utilization of staff. So one thing that I thought that we could bring back is just like the redeployment process and training people, and they really utilized all the staff and put them in different places and had such a good teamwork and group effort that I thought was awesome, that I think that we could bring back here for sure, and just utilizing our people who aren't working right now in these crisis situations.
And I know that we've kind of moved into different phases of the pandemic here in Utah. We're in this low or moderate risk right now. What is something that you want people to know too about this pandemic itself and the severity of it? And as they go out and hang out with their families more or go travel more, to still remember that it exists, what is something you can tell to those people?
So one thing that I tried to do was talk to the nurses and connect with them, because actually in the ICU, I am the experience council chair. So I help focus on like patient experience, staff experience. So I tried to talk to the nurses and kind of get their feeling of like, what have they done for you? How has Northwell, helped support you in this time? And just like, how have you as a nurse felt as we've gone throughout this pandemic? And one thing that those nurses said was, it's hard now and we can do it now and we're tough and we can get through it. But they had like this underlining imminent fear of like when the city opened back up, when people went around, that they would see this surge. So I think that one thing that as a community that we can remember is just I know people don't like it, but just if we like wear a mask and wash our hands and just be really aware of like social distancing and being, having a mask on and being socially, washing our hands and stuff. I think that will really help as we go to open the community. I mean, even here in Utah, we haven't really seen the surge that we saw in New York, but I think all of our nurses still fear the day of like, if we surge and where will we put patients and how will we take care of them, because there's only so many of us. But I think that we've done a great job of preparing for sure.
Yeah, and hopefully we never get to that point, but
Right.
We don't know what's going to happen. So last question for you. How did this entire New York experience change you? I know that's a big question.
Yeah. So one thing that I really felt while I was in New York is just like seeing the other nurses and how hard they were working. I mean, some of them were working like 6 and 7 shifts, so like up to 84 hours a week. Like that's a lot of work in such an intense situation. And just to be able to see them working together as a team with a positive attitude, it made all the difference. And so that's one thing that I felt like I could bring back to my team is like have a positive attitude and really work as a team. It really makes all the difference. And some things that I learned personally is being out there in this like pandemic with this heavy caseload and like heavy, people were dying and you just were over this overwhelmingness is I really learned that I can dig deep, I can pull my own knowledge, and I have the abilities and the power to do hard things, with my team and with everyone around me in my home and in my families. We can dig deep, we can pull together, and we can do these hard things that are put in front of us.
Well, Liz, thank you so much for joining us, and thank you for sharing your experience with us. It's been really interesting to hear about all the different caregivers who've come back from New York, so thank you. And if you guys have any questions about COVID-19 and would like to get screened or tested, you can call our COVID-19 hotline at 844-442-5224. We also still have our emotional health relief hotline available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. There's also lots of resources on our blog if you're looking for information on COVID-19, mental health, physical activities that you can do during this time. It's a great place and a great resource for you guys to go to. Thanks, everyone. We'll see you next time.